Welcome. So this month is October Breast Cancer Awareness Month. So I really wanted to bring you a series of talks and Wellness Wednesdays specifically on breast cancer. If you haven't followed me for long, then you may not know that my mother is a breast cancer survivor, and breast cancer is very dear to my heart for that reason. So in the first talk with this series, I really wanted to kind of give a broad overview, like what is breast cancer? And later on in the series, I'll do a talk about screenings, and another episode in the series, I will just kind of have a sit down one-on-one with some survivors to get a little bit of their story. So, what is breast cancer? Globally, breast cancer is the most frequently diagnosed cancer in women. It's the cause of death in over 2 million cases per year for women. It is also the leading cause of cancer deaths of women worldwide. Now, in the United States, breast cancer is the second most common cancer death behind lung cancer, but it is still the most common diagnosed female cancer. Since the 1970s, breast cancer mortality, meaning death rates, have decreased steadily, and the thought behind that is based on improved screening amounts and types. Like I said, we'll talk later about screening, but what screening helps to do is increase the therapy rates, and therapy saves lives. So when women are diagnosed earlier, then we are able to save more women. Now, the diagnosis of breast cancer requires a histology and pathology. That means breast cancer is ultimately diagnosed on a cellular level. There are some classic signs and symptoms of breast cancer. However, some women, about 15% of women that don't have either access to screening or they're too young for screening, come in to their physician with palpable masses that they have felt at home. Also in that percentage of women includes women that maybe felt a mass in their axilla or their armpit, as we call it. So what are the classic symptoms of breast cancer or mass? Many of you may be performing home self-exams. If you're doing a home self-exam, preferably you want your fingertips to be wet, so use hand sanitizer or preferably in the shower. You want to lean forward a little bit so that your breasts can hang as you're feeling, and you also want to make sure that you're completely filling the entire breast, and you're also going into that axilla or armpit area. The breast tissue carries into that armpit area, and that's also where the lymph nodes that supply the breast are located. So sometimes you may not feel a particular lump or mass in your breast, but you may feel something in that armpit area. Now, like I said, one classic sign is enlargement in the axilla armpit area. But what is a mass? So the mass itself may be hard, fixed, meaning you can't move it around. If you try to palpate it or feel of it, may feel stuck. You may feel irregular borders, and it may not feel completely circular. Usually it's a singular mass or singular lesion that you feel, meaning it's one continuous mass instead of many small things that you may feel. Oftentimes when we're feeling our breast, especially if we're feeling it around our menstrual cycle, you may feel lots of lumps and bumps, but a cancerous mass is one singular lesion. Now, going back to that armpit area, when the cancer is more advanced disease, that's when you will start to feel something in that axilla area, meaning again, one large mass or a painful something in that area. You may also see dimpling, or you may see your nipple retracting or going inward, and it doesn't usually do that. Another thing that you may see is redness of the breast, especially one-sided. Usually cancers are one-sided and not both. And so if you're seeing these changes in one breast and not the other, that's definitely reason to go in to see your physician. Any woman that presents with a palpable, meaning you can feel it, mass or abnormal exam should then be referred on to receive diagnostic imaging, which we'll talk about later. Now, what are those factors that might increase your risk of breast cancer? There are some, and we'll talk about those. The number one factor that increases your risk of breast cancer is age. Of course, the more we age, the more those cells have had to divide and reproduce and multiply, increasing the risk of error or increasing the risk of our body losing control of that multiplication and thus leading to cancer. So increasing age. The female sex. Men can get breast cancer as well. Men have breast tissue, but women are 100 times more likely to receive or to be diagnosed with breast cancer. In men that are diagnosed with breast cancer, they are much more likely to carry those BRCA1 or 2 genes. Race or ethnicity. So, white women are more likely to be diagnosed and have a higher risk of breast cancer than any other minority group. That being said, black women are more likely to be diagnosed or to acquire breast cancer at a younger age. Many times that younger age is less than 40, less than that common screening age. Black women are also much more likely to have the triple negative, the hormone triple negative or more severe breast cancer than any other minority group. Black women are also much more likely to have an increased mortality or death rate from breast cancer. Obesity is an increased risk factor. Obesity includes any BMI greater than 30. Another interesting fact is postmenopausal women with significant weight gain are increased risk for breast cancer. So in studies that were comparing women of a certain age, there was more incidence of breast cancer in women that were postmenopausal that gained weight after they experienced menopause. Also, the more cycles that you have increases your risk of breast cancer. So those women that have earlier periods or those women that have later menopause, those women that have not had children and so have had continuous menstrual cycles all have an increased risk of breast cancer. Those women with dense breast tissue also have increased risk of breast cancer. Dense breast tissue, that can oftentimes be genetic. Many things can contribute to the density of our breasts, age, genetics, etc. But there has been a correlation found with dense breast density and the risk of breast cancer. Of course, a personal history of breast cancer. If you've had breast cancer on one side and you opted for a lumpectomy, but not a bilateral mastectomy, you do have an increased risk of breast cancer in the alternate breast that was previously normal. Also, family history of breast cancer increases your risk. So, if a woman has a family history of a first-degree relative, mom, grandma, aunt, that have experienced breast cancer, then that woman has a threefold times of experiencing breast cancer herself. Also, the younger the age of your family members at their diagnosis further increases that risk. So if you have a first-degree relative that was diagnosed in their 40s, then your risk of breast cancer increases even that much more than that threefold time. What are some protective factors then? So things like breastfeeding are protective. Weight loss is protective, especially weight loss after menopause. would be a protective factor. Mastectomy. So in those women that have found that they have the family history of BRCA gene, increased family history, etc., those women that have had the prophylactic mastectomy, that would be preventative for breast cancer as well. All of these things combined just mean, please talk with your physician. Your physician can outline for you your risk factors of breast cancer and when you should start that screening. So tune in next time and we'll talk more about the types of screening, the interval of screening, and when you should start screening in general for you based on your risks.